Hi, Jerry Rosenberg again, and today I wanted to talk about electrodiagnosis, also referred to as an EMG. It's a test that I have found to be very helpful. It's an electrical muscle and nerve test that tells us if you have any damage to the muscles or any damage to the nerves. It also tells us how bad that damage is, where that damage is, what the prognosis of that damage is, what's likely to help improve that damage. So it's a very objective way to determine what's causing your pain. And that's very important because what I have found is that a lot of times physicians or therapists are not actually treating the source of the pain as much as they're kind of going through standard protocols. What we try to do is evaluate each patient as an individual to determine what their pain source is and develop a treatment program for their particular pain. And the nerve testing allows us to do that by determining what's the cause of your pain. Is it nerve? Is it disc? Is it joint? Etc. The test consists of two parts. A nerve part where we stimulate the nerve with a little electrical charge, and a muscle part where we record muscle activity from the muscles themselves. Once that data is recorded, the patient gets to leave the room, and then I sit down and play with the computer, and we'll, compare this patient's right to left, this patient to other patients, their age and gender, so forth and so on, to determine if there's neurological or muscular involvement. The most common question I get is, does it hurt? And the answer to that question is, it depends where the test is done. Because the older equipment that wasn't computerized required bigger needles and bigger shocks to get the information. Because we actually have the new computerized systems, we get much more information with much smaller shocks and much smaller needles. In fact, with our equipment, the shock is the equivalent of maybe touching a doorknob. It does not hurt, it shocks you. And it's just kind of an instantaneous goofy feeling, but it doesn't really hurt. The needle, because of the computerization, is so small, it doesn't draw blood anymore. It's so small it's barely felt. It's really more almost like a record player needle that's just sitting on the muscle or just in the muscle and making recordings. And most of my patients really don't feel any discomfort at all. And finally, of course, it depends on who does the testing. I'm proud to say that I'm one of the few physicians in Rhode Island who is board certified in this specific test. And when you have somebody that's been doing the test for a long time, he knows where to put the needles, where to put the shocks, how to do the test, in an efficient manner. And it can be, a relatively pleasant experience, not much unlike having an X-ray or an MRI. On the other hand, if you have an inexperienced guy, or physician, or technician, or physician assistant, or whoever might be doing the test, then sometimes there's a little bit more discomfort associated with the testing. The good news is, here in my office, I'm the only one here, so I'm the only one that does the test. And if you need it, it's a good test to have. Dr. Rosenberg saying goodbye.